Hello, my name is McKenna Glasscock, and today I'm going to be talking about the plague also known as the Black Death. The plague is an infectious disease caused by a bacterium called Yersinia pestis. Most people think of the plague as something that only existed 100 years ago, but it's actually still present in the world today, although cases are rare. In this presentation, I will explain what causes the plague, how it spreads, its symptoms, and its history, and how it is treated and prevented. The plague is caused by a bacterium called Yersinia pestis. This bacteria is classified as a gram-negative, rod-shaped organism. It is considered a zoonotic disease, which means it's normally found in animals, but it can be transmitted to humans. Rodents such as rats, squirrels, and prairie dogs are common animal hosts. Humans usually become infected through the bite of an infected flea that has fed on one of these animals. Yersinia pestis has several characteristics that make it dangerous. It is a facilitative anaerobe, meaning it can survive with or without oxygen. This allows it to live in different parts of the body. It also has viral factors that help it avoid being destroyed by the immune system. These features allow the bacteria to multiply quickly once it enters the human body. The plague is most famous for causing the Black Death during the 14th century, between 1347 and 1351. During this time, the disease spread across Europe, Asia, and parts of Africa. It is estimated that the Black Death killed between 25 and 50 million people in Europe alone. This was about 1/3 of the population at the time. The disease spread rapidly through trade routes and crowded cities where sanitation was very poor. Although people had experienced plague outbreaks for centuries, the actual cause was not discovered until 1894. During an outbreak in Hong Kong, a scientist named Alexandra Yersin identified the bacterium responsible for the disease. Later, the bacterium was named Yersinia pestis in his honor. This discovery helped scientists understand how the plague spreads and how it could be treated. There are three main forms of the plague: bubonic, septicemic, and pneumonic. Bubonic plague is the most common form and causes swollen, painful lymph nodes called buboes, usually in the groin, armpit, or neck. Other symptoms include fever, chills, headache, and extreme weakness. Septicemic plague occurs when the bacteria enters the bloodstream and can cause abdominal pain, shock, and bleeding into the skin. Pneumonic plague affects the lungs and causes cough, chest pain, and difficulty breathing. This form is especially dangerous because it can spread from person to person through respiratory droplets. The plague usually begins when an infected flea bites a human. The flea regurgitates the bacteria into the skin, allowing Yersinia pestis to enter the body. The bacteria then travels through the lymphatic system to the nearest lymph node. Once there, they multiply rapidly, causing inflammation and swelling. This leads to the formation of the characteristic buboes seen in the bubonic plague. Yersinia pestis has the ability to avoid the immune system by interfering with the immune cell signaling. This allows the bacteria to survive and spread throughout the body. If the infection spreads to the bloodstream, it can cause sepsis, which is a life-threatening immune response. If the bacteria reaches lungs, pneumonic plague develops, which can damage lung tissue and make it difficult for one to breathe. In the laboratory, Yersinia pestis can be identified using several methods. A gram stain, which shows gram-negative rods. The bacteria can be cultured on a blood agar, where it shows characteristic growth patterns. Modern diagnostic techniques such as PCR testing are often used because they can provide faster and more accurate results, which is important for early treatment. The plague is treatable if diagnosed early. Antibiotics such as streptomycin and doxycycline are commonly used. Treatment is most effective when started within the first 24 hours of symptoms. In severe cases, patients may require hospitalization antibiotics, and supportive care such as oxygen or fluids. Without treatment, the plague could be fatal to one. Prevention of the plague focuses on reducing exposure to infected animals and fleas. This includes controlling rodent populations, avoiding contact with wild rodents, and using insect repellents in high-risk areas. Healthcare workers treating patients with pneumonic plague must wear protective equipment to prevent transmission. Currently, there is no wide available vaccine for the plague. An interesting fact about the plague is that it still occurs today, although cases are rare. In the United States, most cases occur in the southwestern states. Another interesting fact is that the plague is one of the most devastating pandemics in human history, shaping society, medicine, and public health practices for centuries. In conclusion, the plague is a serious infectious disease caused by Yersinia pestis. While it's best known for its role in the Black Death, it still exists today. Understanding how the plague spreads, how it causes disease, and how it is treated helps highlight the importance of modern medicine and public health. Early diagnosis and treatment are key to preventing several outcomes. For references, the information used in this presentation came from a reputable source, including the Centers for Disease Control and Prevention, also known as the CDC, and the World Health Organization, also known as the WHO, and peer-reviewed microbiology journals. Thank you very much for listening.